Hi, I'm Dr. Dave Harvitz with Renewed Concierge Physical Therapy, and today I have Sandy with me, and we get to tell you the story about how she was able to avoid neck surgery in just a few minutes, so I hope you stay tuned for that. All right, guys, I want to take you through the story of how Sandy was able to avoid neck surgery, and one of the things I want to ask you is how long have you been having neck pain?
Probably about 4 years.
Okay.
Close to it.
So 4 years, and when did you finally were like, I'm going to do something about it?
Almost immediately.
Okay, so 4 years ago, take me back.
Yeah.
Who did you see first?
My primary doctor.
Okay, and what did he ask you to do?
They gave me muscle relaxers and told me to get x-rays.
Okay, and what did the x-rays show?
I had a bone spur in my neck.
Mm-hmm. And I hear this a lot. The first thing that primary care doctors want to do is jump right to the imaging. And it's not necessarily a bad thing. We always want to rule some things out, but unfortunately what we tend to do in the medical world is use those findings to actually lead your treatment, which is kind of what ended up happening. So you had muscle relaxers. That didn't do anything.
Nothing.
And you had this bone spur. And what was the next step for you?
Physical therapy, and then all they did there was traction and
Okay.
exercises, which I had relief for probably about a week.
Okay, and then it just would come back.
Came right back.
All right, so at that point, I'm assuming they ordered the MRI.
MRI, and then I went straight to pain management.
Okay, so with the course of action, you had an imaging study done almost immediately, and then physical therapy, nothing really worked, and then you ended up getting your MRI. What did your MRI show?
That I had a degenerative disc at 4 and 5.
Okay, so 2 discs or just the one level?
Just the one level.
Okay.
At the time.
All right, at the time. Now, did that change over time? Did you end up getting more information?
Yes.
What
I had
happened?
an discography done at pain management that discovered it was 2 discs, 4, 5, and 5 and 6.
Okay, so at this point, when was this in the course of those 4 years?
About 6 months ago.
Okay, so 6 months ago, you had that extra study done, which showed that it was actually a degenerative disc. I'm assuming they were feeling like that was causing a lot of your symptoms, both in your neck and your back and your arm.
All the above, I'm assuming.
Yeah. Tell us more about your symptoms. Obviously, everyone knows you had neck pain, but what other symptoms did you have?
Shoulder pain, fullness of the hands, my arms were going dead every night. They would wake me up. They would be completely dead. And then I would get headaches as well.
So you would say, when you say your hands are dead, you meant like you just didn't feel them.
I would wake up shaking my hands just to get them to wake, and then upon waking for the day, I couldn't even make a fist. My hands were so tight, I couldn't even hold my pillow.
So that's very interesting because that's what you told me over the phone. And so obviously a friend told you about me.
Yes.
And you were like, well, you know what, I'm going to give him a call. Tell me your end of the experience in terms of that phone call.
I was excited.
Okay, why?
I was scheduled for surgery. Actually, I was scheduled for post-op or pre-op that Friday. I called you on Tuesday. My surgery was June the 1st. And after telling you my symptoms, you were like, this is not your neck. This is definitely your back, your shoulder, or the nerves in your shoulders are being pinched by your thoracic or something like that. I can't remember.
Well, let me elaborate. So what's interesting, and this is something that I don't think people realize, but based on your nerve symptoms, it tells you where it's coming from. Nerve symptoms aren't this big, massive, well, it could be coming from anywhere. The good thing about nerve symptoms is that there is a very specific pattern. So when Sandy told me over the phone her symptoms, it did not sound like a disc herniation. It did not sound like what we would consider in the medical world a cervical radiculopathy. That's a fancy way of saying of something is pinching a nerve at the neck level. And so what I did was I asked her a few more questions and pretty much found out just by talking to her over the phone that there's definitely something more going on. And so I relayed to her, I really feel like I can help you. She believed me, obviously, and so we did our first evaluation. How did that experience go?
It was great. living in about an 8 to 9 constant pain. By the end of our evaluation, I was probably about a 4 or 5.
Okay. And a lot of your arm symptoms were gone as well.
Yes.
And I think that was what I was really trying to go for, is working on the root cause of the symptoms. And so our evaluations tend to yield pretty decent results out of pain relief, but what we do get is a lot of data. And so what we did was we went through a course of treatment about a month, and throughout that month, it sounds like week over week, you got better and better and better.
Yes.
Is that right?
That is correct.
At this point, where are you? Because it's been a month. I discharged you last week, actually. How are you doing?
I'm doing good. There are still some days that I have pain, but you gave me a bunch of knowledge and keys to get myself out of pain.
And so that's actually really important. I could sit here and say you need more therapy, and you'd benefit from that. But what we do at Renew is not just get you out of pain, but teach you how to keep yourself out of pain as well. What I suppose will happen as your muscles get stronger and you continue to do your exercises, your pain will vanish. And that's kind of what we're going for with this period of time now is, okay, you've got work to do, but ultimately we're going to get rid of your pain through your exercise program. One thing I do want to note is Sandy's diagnosis was not from her neck. Although she may or may not have a disc injury, the MRIs are usually correct with finding problems, but they're not very good at finding the root cause of pain. And so a lot of times, and I'm going to be a little silly here, doctors and PTs, us medical professionals, they go, there's a disc there, and I'm going to treat the disc because there's a disc because it's there, and I see it. And we get tunnel vision in the medical world, and we ignore all of the other symptoms. And so at Renew, what we try to do is we try to ignore that. In fact, I think you asked me if I wanted to see your MRI. I said, no, I don't. Because that's what the other PTs did.
Yeah.
And I that's not what we do. And so what I was able to do is listen to her, and we sat and talked probably for a good 20 minutes before I even touched you. And then from there, I already knew what was wrong. I just needed to confirm it with a couple treatments and a couple tests, and that was what was really good. And so what I did find is that a lot of her nerve impingement was coming from her shoulders, and a syndrome called thoracic outlet syndrome. And a lot of times it's confused, especially when you see a herniated disc in an MRI study, with a lot of the nerve symptoms. And so what we did is we did a lot of work to release the thoracic spine, which is your upper back. We mobilized your ribs to help them be where they're supposed to be. People don't realize this, but your ribs are very much like joints, and we need to make sure they're moving properly. And that was one thing I think you mentioned, is that you had a hard time breathing. You had a restriction there. And as we worked through your process, you're like, wow, I'm breathing deeper. And then another thing too is a lot of the muscles in the armpit and the upper chest and then the upper back all were very restricted. But as we released those, your symptoms in your hands and arms released. You're sleeping with no symptoms pretty much at all at this point. And now we're at the point where, although you do have some symptoms, you know how to get rid of them, and we need some time to allow your muscles to get stronger and then make these changes permanent. Now, in all honesty, will you need another visit or two here or there? Maybe, and that's perfectly possible, but you didn't need surgery, did you?
No.
So in closing, what are your thoughts with this experience as opposed to everything else you've done in the medical world?
I wish I would have found you earlier.
That's good.
4 years earlier.
Very good. Well, anyway, thanks for spending this time with us, guys. I appreciate your time. If you have problems and no one else is finding your issue or the root cause, and you keep going back to pain management, give us a call. There's nothing wrong with a second opinion.